The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. We're just going to wait another minute or so here for everyone to jump on, and then we'll get started. All right, good afternoon, everyone, and welcome to The World in the Windshield, COVID Solutions. What's next for healthcare, K12, and colleges and universities? I'm Jessie Duford, a digital marketing specialist over here at Lakeside, and I'll be guiding you through today's presentations. So our webinar is hosted by Lakeside Manufacturing, Multiteria, and All You Serve. So today we'll cover specific tactics your healthcare, K12, and college and university operators are taking to serve their clients. What solutions operators are requesting to prepare for now and post-COVID, about Lakeside and Multiteria's new and existing products that meet these operators' needs. So for our expert panel, we have some wonderful women joining us. Marcia Diamond, she's a registered dietitian and nutritionist and a CEO of the Diamond Approach. We have Mary Sauer, who is the marketing manager of Multiteria. And we have Nancy Lane, who is the senior designer of visual merchandising and product concepts for the Sandstone Group. So with that, welcome. Please kick us off, Marcia, with healthcare.
Welcome, everybody, and thank you for joining us today, and thank you for asking me to present. So I've gathered information from webinars, surveys I've done, for interviews, and this next few slides is going to give you an overview of it, and any more particulars, please feel free to email me. So starting, we know healthcare operators are getting hit hard. Different parts of the country are getting hit harder now at this point, but we're all getting hit from different angles. Visitor meals have almost stopped. Employees are being transitioned to remote, the ones that can be. And so it has become a never-ending kind of challenge. There's a lot of corona fatigue around, there's compliancy to complacency, and what's happened is there's not an endpoint at this point. So a lot of people have said, you know, what do I do? And so as you can see, they're open for business, but they have to help raise revenue. They have to look at ways to keep still food safety, take care of allergens, as well as keep patient care and wellness. So one of the things that has come out of COVID is the reimbursement availability. Next slide, please. The reimbursement availability. This has come out of COVID, and the GL coding for reimbursement has allowed people to purchase, renovate, reconfigure cafeterias, virtual spaces, 3D printers, different equipment, anything that's related to a COVID type of patient. Either now, if you're in the midst of it, or you're preparing for another surge. They have used coding for hazardous pay, double overtime, disposables, and you have to have at least a 3-month supply. But in addition, many people are using it to prepare for feeding a COVID or isolation patient and the funding and renovating so that they can bring people back into a cafeteria. And if you're not aware of it, there's some other grants going on as well, but just be aware of this COVID. So impact of COVID is obviously increasing time and products for sanitation. Physical distancing, no doubt about it. They're distancing back of the house, front of the house. Labor, they've had to furlough people, and now they can't get back the labor they want because again, people are looking for different types of jobs. They're not always coming back. So labor shortages are happening now within healthcare. The impact, use of technology, robotics, and informatics, and we'll talk a little bit more about that. Could you back up? Gives you an opportunity to evaluate your work environment now with the impact. Look at your design, your back of the house, how you're getting food to your patients, to your staff. The supply chain challenges. There's going to be food shortages, and there's going to be increased pricing with supply and demand. Sustainable packaging. A lot of that has gone by the wayside at this point because of the need for isolation and also grab and go. Impact was in delivery and contactless, and buffets, self-service, and salad bars. So these are the areas they need solutions on. And remember, they're going to be budgeting for 21, and so they're going to require you to help them analyze their building layouts, staffing, help them engage as a business partner on how they can resolve some of these challenges. So COVID has caused disposable costs to skyrocket, and they didn't budget for this. So you have to realize some facilities going from $4,000 to $12,000 per month. And those disposables, and budgeting for disposables, delivery vehicles, cooling shelves, heated shelves, all those materials were not budgeted for, but they had to buy them on a very reactive basis. And at that time, the grants weren't implemented. Now the grants are, and this is the impact. So they will still need more disposables. They will need the ability to have delivery vehicles, whether they're driven or robotics. They'll need the ability to have cool and heated shelves, and to have trucks transport meals between buildings and between towers. Another impact was labor costs, which I've spoken to you about. It's about 6% rise in hourly labor costs due to the single site staffing. And what I mean by that is that if you have a single hospital, you probably didn't have a rise in the cost, maybe with OT, but that was covered by the COVID grant. But if you have multiple sites or multiple health systems or multiple senior living where you use one employee for one day and maybe use them in a different day somewhere else, that has changed. And what has happened is that because of safety and priority, they've decided to just have one person work in one facility versus transmit things. So again, that's where the 6% rise came into being. And also things like feeding people salad bars, ice cream stations, and self-service points changed. So they needed people to man those kind of things. And again, that's where your pricing went up. So be aware when their cost, if you can offer any kind of equipment or any kind of reconfiguration that can help them offset some of that, yet give them the quality and also the customer experience, you'll have a win-win in that component. Another impact was food and equipment costs. And most dining leaders have found food costs to be lower or flat compared to last year. But however, not knowing what will happen in the future, they have said the top 3 areas they want manufacturers and distributors to help them in is to lower the purchase minimums between equipment and food, help them with new products and solutions that will help them and enable them to be transparent and to continue increased sanitation and safety. And they want more purchasing discounts or rebates, especially with items related to their solutions for COVID and beyond. Some of the surveys and interviews, I asked them, what is the biggest challenge moving forward? And their biggest challenge still needs to be communal dining and dining footprint. How do you set up the dining room? How do you offer somewhat of a community? Distancing in the back of the house and the front of the house. A big thing that's been going on now, especially in the Northeast, is staff morale and safety. Everyone was very concerned with frontliners, as they should be. However, you had a lot of food service staff that didn't feel the same kind of love and attention. And what has happened is it has become an issue, and food service directors are finding that they have to kind of motivate their people and feel comfortable. And so I'm going to give you some ideas on how to approach that. Regaining confidence in food safety from the customer point of view. Revenue, obviously, retail venues have got shut down or have been limited, so the revenue has been challenged. And food quality. Temperature and presentation between patients and residents and staff. How do you retain it with the equipment that you have? How do you retain it with the grab-and-go kind of component? And how do you retain it with the isolation, specifically the COVID patient? They still want safe person-centered care. They still want the sanitation. And the other challenge is the unknowns. Not having a crystal ball or an unknown has been a real challenge for them. And those are things to be aware of. So some things that come out is there's new building kitchen code. And they've talked about this, the pre-clean sanitizing area and receiving areas with sinks, maybe even refrigeration out there or freezers, having a stainless steel table on the inside of their delivery areas, more storage, dry racks, and frequent sanitation. The reason this has all come out, it was starting to come out pre-COVID, but it has obviously got exaggerated, is because, again, any way you can limit cross-contamination or the virus traveling by letting people who deliver drop it off and not come into your facility is kind of be the protocol for the probably next year. I don't know what will be after that, but I know that for now, they are looking at things to heighten it so that they can minimize any kind of contamination. Some other things that are going on that you can be aware of is how do you buffer between the back of the house and the front of the house? And some ideas that have come out of it, out of speaking to people, is having expedited as a buffer between those who can touch food and those that cannot, especially on the tray line. Designate separate entrances for the front of the house and the back of the house employees. Visual cues, different colors for gloves, aprons, and head coverings if they're front or back of the house. Again, the more designation and transparency, the less problems or the less minimizing of the problems. Front of the house, how do you keep your staff safe in a way and your customer having barriers? Maybe a table in front of a beverage station that is being served from, using furniture and location of furniture, having your staff eat in a different area from your visitors, minimal visitors, having your staff eat differently from nursing, disposable and digital ordering, and minimal contact food delivery. Think about installing it. Somebody was recently said in the UK, they noticed an electrical fence in one bar to keep people back from the bars. Well, I'm not saying put an electrical fence, but certainly something that can designate that, hey, don't step over this line. This is our safe zone. And they are considering more and more things. So consider buffers. That's a new term, back of the house, front of the house, buffers. What buffers can you implement to make this safer? Another thing that's going on is the kitchen is the heart of, obviously, every restaurant, every food service. And the problem is, what do you do? How do you minimize connection in the back of the house? A big challenge in one of the hospitals in Oregon is that before PPE was required, the whole food service staff, about 14 people, had to be quarantined for 2 weeks. So you lost your whole back of the house crew due to, again, lack of PPE, lack of understanding and protocols. So what many facilities are thinking about doing is taking some of the food prep from the back of the house to the front, even though now you have the PPEs, but working with more action stations, mobile prep areas, some of the multi-tier kind of items that you can put in the front of the house and show people how you're cleaning. Example is a Japanese restaurant doing some prep, and in the restaurant, it was noted on the internet, is that even though they cleaned it after each meal, they decided to sanitize it as the people were surrounding it. So again, that transparency, having this front of the house food prep allows that to be happening. Some other things, future code requirements may state certain amounts anticipated in the kitchen employee, and UV lights are becoming big in coolers and storage areas, as well as in sometimes customer space because they kill off the virus, the COVID-19 virus. I also started to see UV lights in Whole Foods, using for door handles, packages, and freezer doors. Again, all related to the windshield ahead. How do you keep things safe? Safe is a kind of keyword in the ambience of the future. Some other areas you may have not considered is the dining office. Oh, let's do back of the house. Sorry. So one of the other things with back of the house is, if you see the green configuration there on the screen, that's where you can put in these dividers. And so, yes, it may not be 6 feet, but it is a distance, a physical distance. And you, again, increasing morale, saying we care, also helping those people mitigate any risk. They're clear, so you can see. And so that's something that has been considered in some back of the house. How do you make your back of the house environment safe from a realistic point of view, as well as from a morale point of view? Some people have told me they're starting to do that, but the problem with the shields and the mask is that they can't hear or communicate. So some people are starting to think about having some kind of, they're looking at some technology, technical communication, so that they can hear clearer from, especially the cooking area, back to the front of the area, because if you're having distancing. So things to be aware of. Even though you're instituting these things, you still have some other challenges that will come out of a distancing, especially communicating, hey, I want medium well, the hamburger, etc. So the other area that's also back of the house is the dining office. And what was happening is dining offices are really a kind of a hub of where technology and diet clerks and some of your dietitians are. And so what was happening is you didn't have a way to mitigate because you didn't have a lot of room. So some facilities have put them in separate rooms, some are allowing them working remote, and some have put up these dividers as a first stop. So be aware that between the mask and the dividers, it's mitigating, it's not eliminating, and there has to be a better way to do it. But what a lot of these directors felt that if they wear the mask, the probability for getting sick less with the flu season and COVID would be less. But again, the more you can come up with solutions for that diet office, especially when it's the hub of a facility and it's not separate. Other things that have been going on in healthcare is meal service modification, specifically hospitals that really had to turn on a dime and really get food out. They weren't serving it on plates. So these are meals that were served to patients, and they had to use disposable wares for full house. Not only COVID, some hospitals were lots of COVID, but full house. And so they had to make it look appetizing, but remember how many disposables they're using. This one is using a tray and a bag, but some of them had to use disposable trays. So meal service modification, when you look at your menus and how you had to modify menus, both for back of the house and the front of the house, you also had to make sure it was going to look good in a container, retain the heat, and be able to be delicious when eaten. Other challenges, as we spoke about, was the supply chain. Again, supply chain not only from food, but from disposables. People are stockpiling right now 3 months supply, because if it comes out, they won't have the supply. Well, they're having a hard enough time getting the 3 month supply that's in-house because they can't get, there's a lack of styrofoam trays, to-go containers that retain heat. And then they said to me, how do they stage and hold these temperatures in these disposable containers? If they use a heat lamp and they're using styrofoam, well, you know what happens. So they're looking at bento boxes that are disposable that are more high temperature. They're looking at different ways that they can retain the texture and taste of these products. I mean, it's a whole new world as they move forward. Eventually, some places who have less COVID right now went back to China, but many are still stockpiling these kind of items, and they know that it'll become a challenge again if there's a surge. So dining rooms have been disrupted. And so here's some ideas. 56% of healthcare operators reported food sales are down. So some ways to increase your revenue is to do outside dining, just like you do in all of the restaurants. Ordering food via smart devices, pop-up indoors retail on the way out after somebody is getting a procedure, or a visitor, if they're allowing visitors, is not going to stay in the hospital, be able to have a pop-up and get some food and leave. Modifying your menus and hours, reflecting on what cases you have of COVID and what your staffing models are. And it's okay. You can have a modified menu. If you're doing a menu, pick items that you do great and make them great. Hours reflective of it, and maybe have alternate vending or robotics or Sally, with different things that can implement or complement. Put your plexiglass dividers out there, limit the seating, stagger meal periods for staffing, because then you can allow people to come into a cafeteria, and make sure you have lots and lots of floor and staff signage. I think the biggest thing, what I see in healthcare, they've got it right, but I see it in retail and restaurants, they don't have any signage. They don't say wear your mask. They don't have anything on the floor. And that's really, if people aren't communicated clearly, you know what happens, chaos. I just wanted to show you this layout. This layout kind of gives you an indication of the pre-COVID restaurant layout and post-COVID. And I know it's a restaurant, but the idea is this is something to consider both for your cafeterias, your restaurants, college and university, non-commercial and commercial. Think about considering this. It's going to happen for the next year and a half. People are going to feel need that confidence builder. And so think about these ideas of implementing kind of with that image, and so you get the loyalty, the customer, and people feeling safe. These were great depictions of what I think I know many of us would feel safer eating in an environment like this. Obviously, this is indoors, but obviously a lot of us are eating outdoors. But when you come indoors, how you can implement it and make it safe. And the big key here is transparency. Let people see what you're doing. If you have a pre and post, show people visual, social media. The other thing is some upgrades that will be implemented with retail, looking ahead, is obviously you're going to have condiment stations and utility stations that are individualized. You won't have, obviously, the ketchup pump. Even though that some say that it's an automatic pump, I don't think the safety component of it will be there for people. Again, perception. You'll have more prepackaged silverware, more glove dispensers, more physical barriers, self-cleaning equipment, touchscreen robots, heated shelves and delivery stations. These are going to be necessary upgrades as we move forward. To go with the go approach, grab and go, you have to make sure it's identifiable. Packaging, sometimes you'll have double packaging, like some of these sandwiches were put into a box, but a lot of people have claimed that they would feel good if it's wrapped and then packaged. So when it's a sandwich, that, again, it's that safety perception. It may be safe according to the CDC, and it may be safe according to infectious control. However, they will choose that food item if they're not going to feel safe about it. So choose your boxes wisely, temperature wisely, stage them, use these salad bars to stage them, identify them, and make sure you consider packaging. It may not be the same old packaging, and that's a real consideration of safety. Otherwise, you won't sell it, and therefore gain your retail. Other things that are going on is people back, the home meal replacement. A lot of staff has kids back in school now, and with these staff and the home away meals. So that's another way you can increase retail revenue, is by offering these things. A lot of people are doing it, you know, these meal delivery components, they get delivered to your home. But if you were able to offer it in the hospital, pop-ups, groceries, these kind of approaches, this would allow you to, again, gain your reputation, gain loyalty, and offer people a value add and increase your revenue in doing so. There's some creative things that people are doing out there, and I think this will only grow as people don't have time to make another stop and they want to mitigate their risk. One of the things that I saw out there that I thought was pretty interesting was a new delivery model, kind of a European model called a shaker station. And basically you have all the ingredients laid out and someone's behind there, and basically they choose it, then you put it into kind of a shaker, and then you give them choice and customization. It's like those salad bars kind of mixed, but here it's behind, that's kind of the European display cases. So you reusing equipment that typically may be used for something else, and having safe distances. So these are great ideas. Look at your equipment, what you can do, how you can recommend other people to do. Look at the equipment they're using and give them these ideas of repurposing them. Another thing that I saw that I really enjoyed seeing was these pop-ups and food lockers. You've got a bunch of companies that have food lockers. Some of them are ambient, some of them are cold, some of them are hot. They can be a combination, different heights, different sizes, to hold and retain the temperatures in these disposables. They can be contactless, touchless. Again, great things out there. And I think these will stay because this is a great opportunity, even when things get back to the new normal, to have food available and not have to have someone waiting there or a pickup counter where food gets cold. The other thing is these pop-ups. They have been great. They've gone from very large to very small, but depending on what population has COVID or how much what is going on there. Another thing which I really love is the repurposing of using a delivery cart in between mealtimes and bringing food up to the staff. How great is that? Bringing it to nursing stations, bringing it to visitors, increasing retail volume, and also building relationships. Great ideas. Another thing that will continue to happen is social distancing. So again, these are some ideas looking around between the signage, and you can see the physical distancing. Again, easy solutions. Some things can be hung from the ceiling. Choose your materials for ambiance and safety and for cleanability. Prefabricated things, visually seen. Again, I use the term social because it's been used a lot, but I still like to use physical distancing because we're such a social being. But physical distancing is here for a while. It may even help reduce flu season, but it is here for a while. So think about ways you can help your people come up with different ways to give that food safety. So in summation, the journey ahead is about prevention. And back in April, one of the senior livings in Lincoln, Nebraska, purchased robots that use UV-2 lights to disinfect areas. You can see it on the right side. They're called germinators. And they've never had any cases of COVID-19. They've used it in their facilities, throughout their facilities. So now they're setting aside funds for purchasing plexiglass, creating separations in the dining room, and to, again, be proactive versus reactive. Accelerate your initiatives, your quality control, look at the quality control, look at it through the eyes of your customers, your residents, your patients. But here are some ideas that I put up on, and you'll be getting a copy of this PowerPoint. So these are ways for prevention and being proactive and to continue to be proactive as you go ahead. Some ideas from equipment possibilities and for long-term care is using the CZ2 carts to bring food to each resident, increasing the communal feeling, happy hours, the ice cream, the snacks, healthcare, tray line physical distancing markers, as well as maybe using vertical space such as a starter station to accommodate more supplies for trays, an isolation cart to hold all masks and PPE, more room service carts to modify the room service to let people out in a smaller period of time, touching more people. Delivery options, physical barriers in your diet office. In healthcare, some of the ideas I thought of were disposable wares, holders, having holders available, merchandising cards, micro markets, coupled with other business partners with technology, pop-up grocery retail, open air dining alternatives, having heating lamps outside, because if you can go further and give people a safer alternative, they're going to eat there and they'll come there. All-terrain carts to transport to different locations. If you're missing your salad bars, find ways like Sally Robots, and there's a farmer's fridge. There's lots of things, and you can put the lakeside tables next to it for putting and portable countertops for staging. The hand washing thing. I know the portable ones, the ones that have stop timers that tell you 20 seconds. Another idea is the ability to stage food areas to make trays or finished meals. Storage for packaging. There's no place to put these packaging. It's holding in back of the house. Physical barriers. Again, these are some equipment possibilities. Food lockers, using a closet space to do a virtual retail kitchen, doing ghost kitchen. So these are the possibilities to continue to think about prevention in healthcare. Again, challenges you're going to have, give them options, pivot, and move forward.
Thank you so much, Marcia. We're going to throw up a quick healthcare poll here just to kind of get an idea of what all of you are seeing out in real life. So we're throwing this up here. From your knowledge, are healthcare facility, community dining, and or cafeteria locations adapting to COVID by either building new, renovating, or reusing what they already have? Just gonna have this up for a couple more seconds. All right, so it looks like by and large, facilities are reusing what they have, with about 13% renovating, and not too many thinking of building anything new during these times. So with that, we're going to transition over to the world of K12, which many of you are probably living right now, whether that's virtual or hybrid or in-person classes with your own children or grandchildren. Mary is going to kick us off with K12.
So thank you, Jesse. So welcome everyone today. I'm going to take you through the K-12 landscape and share some of the challenges that have affected their programs since COVID started. So this is what hope looks like. When COVID began, schools pivoted immediately with the mission to feed children no matter what it took. These food service professionals, and they truly are, they're heroes, did everything in their power to continue to feed students, offering hope to families who relied on this national school lunch program for meals. So here's an example on the left of some solutions in other countries and what they're doing for social distancing. On the right is an example of a school in Florida. On the top picture shows students 6 feet apart in the hallway. Below is 6 feet apart in the classroom. On the right, you can see their social distance outside, and all teachers and students are wearing masks. So the financial blows of COVID have been astronomical. Most school programs already faced, oh, I'm sorry, Jesse, are you going back? I think it skipped a couple of slides. Okay, financial blows. So most school cafeteria programs already faced much higher food, labor, and transportation and packaging costs. With the school closures, it left many programs struggling to cover the fixed costs and staff salaries that they were paying since COVID. And additional expenses like the grab and go carts, the packaging supplies, the meal transportation costs, and PPE have really put hard on their spending. So USDA, where is funding coming from? The U.S. Department of Agriculture approved an extension for the relaxation of waivers that will be in place till December 31st. So this extension means that all schools participating in the National Food Service Program and summer feeding will have their meals paid till the end of the year or until funding runs out. The flexibility allows operators to continue serving free meals to all children outside of traditional feeding models into the fall months. They also have a HEROES Act that was passed in May 15th. They have a HEALS Act, and also they have millions of dollars earmarked for the expansion of school breakfast. And food service directors will need to apply for these grants. So will universal feeding pass legislation in 2021? Most thought this was a dead issue, but it's definitely skimming the legislative surface again. Universal meals would not only allow food nutrition to feed children without worrying about the reimbursement paperwork in the midst of this crisis. But on the flip side of universal meals, a director in Wisconsin brought up a fact that if all districts were to go this route, she's not sure which problems would be the biggest. Would they have enough equipment to provide a meal to every student? Would the supplier be able to stock enough for them to do this? And will there be enough staff to carry this out? This will remain to be seen if this legislation passes. So the key challenges in opening and staying open, number one, safety, sanitizing, and social distancing is the most important, and at times hardest to achieve as schools continue to reopen. Some of the biggest challenges is budget and funding. Spending has surpassed the amount of the reimbursement rate because they're having to pay more for the individually wrapped product. More labor is needed to accomplish these feeding models. And given the uncertainty, they expect to continue to struggle and will need these COVID dollars to support their programs. Otherwise, they're looking at closures, layoffs, also possible quarantine if COVID cases rise. Some schools have already seen some supply chain shortages and also PPE shortages for like gloves, masks. So there's 6 service models. Meal service in the classroom, which would be direct delivery of the food with safety and sanitation protocols in place. Hallway, common area meal distribution would be mobile serving lines set up in the hallway. The students would take the food either back to the classroom, to the gym, auditorium, or even outside. Cafeteria meal service. They would bring the classes down one by one. Social distancing protocols would need to be in place with sanitizing and hand washing. Mobile satellite feeding, pre-order and pickup. Technology and logistics challenges would be great for many schools. Virtual model hybrid, they would be feeding grab and go off the bus with individually wrapped product served from mobile delivery carts. And then curbside, take home or bus delivery. This will continue through the fall and winter. Whatever districts and schools decide, they must be prepared to be flexible and ready to pivot if circumstances change significantly. So meal service in the classroom or satellite service, what does it look like? As you can see in the bottom right, a school district actually took their equipment from the cafeteria and set it up inside in the hallway if electrical allows this. Otherwise, they'll be using mobile carts to take the food directly to the students. However, in speaking with a director last week, she brought up a challenge now that she has successfully reopened and is serving from several different models. They're currently struggling how to provide a broader range of options that the kids were used to before COVID. So the challenge is serving hot meals to accommodate this feeding. They want to continue to scratch cook and pack the meals themselves because this saves on budgets. However, the challenge is how to keep it warm. Plus, students are not used to these platforms and these meal restrictions. So the concern is that they may lose participation because of this. Cafeteria meal service, what does this look like? As you can see on the right, students are facing the same direction with marked off seating. There's no touch POS payment systems. Social distancing and wait queues are in place. And then there's consistent sanitizing protocols in between each student, each class that arrives. Keeping students fed and food service staff and students safe will continue to be the biggest challenge. So curbside pickup and delivery. They put this in place when COVID started and have been successful with this. However, with the extension of the USDA remains. The food pickup model still requires families to come to designated sites at a specific time, and many can't. In the beginning, parents were furloughed or sheltered in place. Now that they're back in work, there's a challenge for them to step away in the middle of the day to pick up the food. So there's going to be a challenge of how schools are going to do this. Some schools actually have bus routes that go the route and deliver the meals. Other schools are going to have a challenge getting the word out to have people come at the designated times. So these are all the challenges the food service professionals face each day. Reopening, as you can see, there is no one model. There's so many uncertainties that will continue to evolve in the coming weeks. One thing we do know is that schools have to pivot and be flexible at a moment's notice. Everything is going to be fluid and changing as the weeks evolve. So now I'm just going to take you through a couple of school districts and how they've implemented. West Claremont is a school in Ohio. They opened up August 28th with 3 different platforms in place. An all-in platform, which is the largest model in the district, a 50% capacity hybrid plan, and then full remote learning. For the in model place, they're going to utilize alternate dining spaces and a breakfast in the classroom for the lower grades. For lunch, mobile meal service available, so they'll pre-order and pick up. All in all, she said things are going pretty good as can be expected. And they did suffer a few supply chain challenges. They had to revamp and cut down their menu, but overall things are going well. They're also making sure that staff morale is up. Food service staff have been stretched to the limit since COVID started, and they make it a point of checking in to make sure everybody knows they're not on an island, they're all working together. And here's a little bit more detailed platform look at what she's been doing. You're going to get a copy of this so that you can further look into it. So Mason City Schools, they anticipate opening with 30% less students this fall. The district plans on no meals in the classroom due to labor. They're going to downsize the menu and possibly have a staggered school schedule. If they are eating in the school, they'll have different serving platforms. Curbside pickup will be for virtual learners. They are going to anticipate applying for grants so that they can get more breakfast carts. Next slide, please. Cincinnati Public Schools. They plan on reopening September 28th. That will be an all remote beginning. After that, they plan on a blended learning model. They will introduce slim lines that will keep the students in their own lanes to focus on social distancing. They plan on preparing in-house individually wrapped packaging with their commodity products to save on budget. And they will be distributing bulk boxes. So 5 days of breakfast and lunch will be distributed to all. The food service director really has no idea how it will look in the beginning. It's going to be a process of trial and error. Cleveland Metropolitan School District, they plan on a complete remote learning the first 9 weeks. After that, they plan on going to a hybrid model, which would be half days, grab and go breakfast and a lunch at remote locations. So New York City, one of the largest districts in the country with 1.1 million students, they plan on not returning until September 21st. It's going to be all virtual. And then after that, it's going to be hybrid classes. Lunch likely will be served in the classroom to minimize interaction. Grab and go meals will be delivered to the lower grades. There'll be pickup point designated for the upper grades. Students virtual pickup lunch from their own school building or near their homes. They may even be considering outdoor learning spaces if weather permits. So maybe schoolyards, local parks, they may even consider closing off streets to accommodate all the models of service. One more large school district is Texas ISD. They serve 154,000 students. They're going to start all online. Classes are going to begin after October for in-person learning, and they will be doing curbside meals. I just wanted to give you an overall look at some different school districts. And as you can see, there is no one platform, district by district, state by state. It all comes down to what the state can do to reopen. So I just want to show you an example. We surveyed 69 food service directors. And this one question, what changes do you see coming as far as equipment needs to address the new methods that will be required? A third anticipate equipment purchases with a lot more mobile options, grab and go, delivery carts. warming carts to distribute meals in the classroom. A third said they're going to reuse equipment. They're going to modify or make do with what they have because they have no budget for equipment. And then a third said that they have no idea what they're going to do. They're going to wait until they reopen and address it when the time comes. So as you can see, this is the landscape as it is today. It will continue to evolve, and that's it for now. So I'm going to hand it over to Nancy Layton.
Thanks so much, Mary. Just as a follow-up to your presentation to get more of a pulse on K12 right now, we have another quick poll.
Okay.
So now that K12 districts have reopened or are reopening, you know, what are conversations looking like? You know, is there focus on safety or new methods of meal service? A couple different options there for you all to choose from. So this looks like a pretty interesting split here. About 60% or so are really focused on safety protocols, and I guess the top two would be the safety protocols and supporting new methods of meal service. And that's why we're here today, to really talk about what are other places doing out there. So again, thank you, Mary. Nancy, will you kick us off with college and universities? I know that this has been a real interesting one.
Yes, thank you, Jessie. We'll get started here with the colleges and universities. It is definitely been in the news. Some of the small colleges are closing their doors in the middle of the pandemic. They just can't make it. They were struggling before, and now this really pushed it. So Wells College in New York, they can't go with remote, so they're going to close their door permanently. There's an estimated 20% of the America's private liberal arts colleges, about 200, will go under with COVID. Some of the universities have went remote for the fall, some have brought the students back on, and some are sending them back home. So it's kind of been a roller coaster for the university market. Stanford University has a wonderful, it's called Clean Dining. Take a few minutes, jump out on their website and look at the video. They show the students how they will, when they get on campus, be able to get into the dining halls. And you can see the hand washing sinks right there. They cannot enter the dining hall. They go through about 4 checkpoints before they get to the sink. And then when they get to the sink, they have to wash their hands before they enter the dining hall. It is all grab and go and take out. Ball State and UGA, all the large universities have plans in place. I was just talking to the director at Ball State, and they have isolated and quarantined over 200 people. They have to deliver the meals to them, and they have to give them 3 meals a day. They have, what they do is they drop it off at 11:30, and they give them lunch, dinner, and breakfast for the next day. They also have to have full PPE equipment. So they have to have the gown, the gloves, the mask, everything to deliver the meals. But again, they got 3 locations that they're using for quarantine and isolation. CNU videos, this is very interesting. This is at UMass. Jump on their website. Chef Tony designed these videos with recipes, and they're fantastic. He started in March. How can you connect with the students when they sent them home? And this was his idea. The students love it. There's at least a library of 50 different recipes out there, and he has another chef too. So take a minute. But the Gen Z, they don't want to read a recipe. They want to watch a video. Colorado, this is another one. About 2 weeks ago, I was talking about this video, and it shows the back of the house, what it's going to be like for the students to come on the campus. And then right now, last week, they're sending all the students home. So they're doing another video and webinar on how to move off campus and get your credits and refunds. Face masks, coverings, these are very important. Marcia talked about it too. You will see a demand for gloves and a shortage this October, and 4 times the cost. There's just a large demand for gloves. So again, understanding what disposable shortages will be like and PPE shortages. Grab and go, we were talking about that through the different markets. Customers still eat with their eyes, so make sure it's visual, it looks nice. This was at UMass, nice display, tilted toward the customer, just a great presentation. Grab and go food and packaging. Make sure that it travels well and it holds up. It's about 20 minutes after somebody picks up a package to go or a container, and then they're going to take it to their location to consume. And so make sure that, you know, fried food does not travel well. Don't do French fries, fried chicken. Any of that stuff is really a challenge. Or look at your packaging to make sure that it'll hold the right product. Pop-up locations, they're putting up tents. They're putting up different things to move students across the campus. They're bringing out the food trucks. They're letting them go into the gymnasiums and using that for seating, the rec centers, the lobbies. A lot of directors are saying, hey, we're popping up these grab-and-go stations in our lobbies, trying to scatter the food across the campus. This was another thing that came out of COVID. This was from Kitchens to Go. It's called a Pop Mart. It's a containerized unit. You can see the 2 down at the bottom of the base. That's for a forklift to move it around. Again, this is a great option for grocery, convenience store, meal pickup. As the customer approaches the Pop Mart, they will have hand sanitizer and then go in, and it can be, the POS can be prepaid, however you want to set that up. But again, it's just giving you another option to spread people and students across the campus. This is at Rice. I thought it was very interesting. They popped up 9 different locations for temporary outside seating, classroom, and dining. And the students that enroll at Rice, they can either live on campus as option 1, or they can live off campus and enroll and be able to make it to classes. But they can also do remote learning and not live on campus. And then the last 2 is very interesting. They can take a gap year and enroll as a gap year, and then not enroll and leave totally. So they give them different options. Here's a great tent that's popped up. It's, again, used for seating at a dining hall. So you go in, grab your meal, and come out, and you would go underneath the tent with the picnic tables. As you enter the dining hall, you would see this is a great counter, Multiteria counter that was installed as a salad bar. And what they decided to do after with COVID was they turned the green lights into the green line, which is the pasta line. So as you enter the dining hall, you would go to the left for your pasta, you would go to the right for the grill, which would be the orange line. So you can make an easy choice and then again exit and go out to the tent to consume your food. This is out in Colorado. This is Colorado State University. They want to stay open all the way to Thanksgiving. They have 5,333 students on the campus. They have 10,000 meals a day. They also have a C-store with a click list for pickup, and they offer over 250 items. They have grab and go on their locations, and also to the fountain drinks. Somebody will serve you the fountain drinks. There is a shortage on aluminum because everybody's using aluminum cans. So they went back to the beverage fountain machines, but they have somebody serve it. They don't have people touching it. And again, sanitizing and cleaning is very important. I thought it was interesting. One day it was 90 degrees, the next day it dropped 60 degrees, and it snowed. So out in Colorado, you're telling the students to take their food and go outside. It was a little tough when it snowed that day. This is Coke. They have a contactless and they have a QR code so that you can walk up to and tell the machine what you would like. And then to the right, we have a new machine that we brought out here, and it's a hands-free solutions for the condiment dispensing. And again, it's got a foot pedal down there. It doesn't require power. You would push the foot pedal, and that would push the pump to give you ketchup, mustard, or relish. So again, being able to use your bulk condiments, but not touching the pump. And this is QList, a great app that they're using on the campuses right now. And they're using this so that people can queue up and they don't have to stand around and wait. It'll send a message to them, letting them know that they're ready to go ahead and get in line. So the food supply channel, again, if it grows on a tree, you're going to be okay. If it grows on the ground, it's going to be a challenge. You're already starting to see the shortage in canned tomatoes. You're going to see that in beans. There was a couple things that happened in the spring when all this took place. You know, that's the peak time for all these food manufacturers for weddings and vacations and sports. And then all of a sudden you just turn that off, and now all this food was going to waste, and the farmers decided they would pull back on what they were planning. Plus FEMA came in and purchased a large bulk of food. So it's going to be a little tough in the fall. So some of these directors are slimlining the menus and being challenged with this. So we want to just say thank you again for taking the time to share with us today the world in the windshield. And Jesse's going to turn this over to some questions that she has.
Yeah, thank you so much to all three of our presenters. I know that you all have been getting a little bit of whiplash trying to keep up with your presentations, constantly updating them every single day. But yes, we'll do some Q&A. First, a quick poll, same as K12, but focused on college and universities. So take a look at that. Want to see what everyone else is seeing out there, and kind of what the conversations are looking like, if you know what the focus is. So definitely, it's looking like it mirrors K12, and you know, the biggest discussions around the safety protocols and solutions for new methods of meal delivery. So opening it up for questions. If you do have one, please submit. I know we have a couple already here. Let's see. Let's start off with. I guess this can go for really any three of you. At this moment, what 2 to 3 must-haves do you think is needed to increase customer confidence for eating or buying food at retail venues?
I will. I think the three things is showing some kind of disinfecting surfaces. So what are you doing is it electronic? Are you using a UV light? What are you doing? And making sure it's communicated, that safety component. The other thing is, how are you packaging it? I think people with electronic cleaning is the mask. Are you people wearing masks? So it's all around the safety. I guess that's number one. That's kind of the new ambiance. And I think for me, that's, if I had to say 1 and 2, it's related to safety. But don't forget about the quality of the food. I think, yeah, we want food to be safe, and we want to know the surfaces are sanitized, and we do want to know people are wearing masks and handling it with gloves. But we also want to know food that you're making is good quality and it's held right and it's at the right temperature.
Sure. Thanks, Marcia. This sounds like it's a good fit for K12. I have heard a lot of chatter about streamlined menus. What are some tips in executing fewer food and beverage menu items, but hopefully at a higher volume?
Nancy, would you mind taking that one?
No, that's fine. You know, one of the things that I've heard from some of the different webinars and presentations that they've been talking about is to, again, streamline the menu and do the best that you can with the products that you like or the menu items that really work for you. And you're seeing a lot more streamlined in K through 12 because of the challenges of the food and switching over from bulk food to individually wrapped. So you really need to sit down and work with your staff and brainstorm on different ideas for that. You know, the thing with, again, K12, they've got a lot of challenges when they want to be able to cook the bulk food. So focus on things, and comfort foods are really number one out there right now. Meatloaf is back. You know, it's just everybody wants that comfort. So.
And
I can add to that.
And I'll just add that when it comes to the curbside feeding, they need to look at the menu and make sure that it travels well. Packaging, the individual packaging, whether it's in foil, clamshells, bags, they need to make sure that it can serves the food safely, but also that the food quality holds up.
And I want to add, especially with schools and universities, people are, and healthcare, they're still looking for healthier options and more fruits and vegetables. And even though you're giving comfort food, you still have to consider that component of certain types of fruits and vegetables, incorporating things so that it's not just comfort foods, because if you don't give them proper nutrition, then you're really defeating the purpose of this meal service. So I think it's a combination. It's just modifying your menus and putting together the best of what you do right. And also when it comes to retail, it's looking at things that are more popular and just maybe enhancing it in some way that it fits those criteria.
Awesome. Well, thank you to all three of you. That brings us to the top of the hour. If you have more questions, feel free to reach out, info@elakeside.com. And we hope that everyone has a great rest of the week. We'll be sending out a copy of today's presentation for you in the next day or two here. So thanks so much to our speakers and for everyone for attending.
Thank you.
Good afternoon, everyone.
Have a good day.